Dr. Asha Baxi, and I'm going to talk a little bit on surgical menopause. Surgical menopause is something which we all come across in various ages. It is not only the natural menopause, and I think it's a very important issue because it has its own long-term effects. So a little bit about me. I work in Indore and I'm a lead consultant at Dr. Asha Baxi Fertility Center in association with Motherhood Hospital. And currently I'm Vice President-elect of FOXI. My main interest is infertility, endocrinology, and reproductive medicine. So when we come to menopause, then it is not that every patient needs one simple formula and that is to be fitted. I think it's very important to take a good history, listen to the patient's problem and solve it accordingly. Every patient may not need a complete oral hormone replacement therapy. Some people may just need local hormone replacement therapy. So you have to really find out first of all the cause and what are the problems associated and then treat accordingly. Now, nearly 10% of Indian women aged between 30 to 49 years experience natural menopause, whereas 6% experience surgical menopause. Now, this surgical menopause can be at any age, and sometimes even in young girls, there may be malignancies and some other problem for which ovaries have been removed, and that may lead to sudden menopause. Then, many times, because of some other problems, and even when you want to treat the patient for hysterectomy, and some people on purpose remove the ovaries. So in that case also, especially women of perimenopausal age, they may suddenly develop the symptoms of menopause, and it's very important to help them. So it is not only that you have done the surgery, treated the menorrhagia, and that's it. I think at the same time, we have to follow up these patients, and according to age, we have to give the HRT, and depending on the symptoms, we give the HRT. Now, what are the symptoms of menopause? I think everyone is aware of these symptoms, and they are hot flashes, and they can be terrible. Sometimes women are really, it affects their quality of life because you're a working woman, and even at home, if you're working and all of a sudden you're full of sweat, then it is so embarrassing and frustrating. So it's and sometimes you may get hot flashes 1 or 2 times a day, and sometimes 15 to 20 times a day. And even in the night while you are asleep, you may get hot flashes. Then vaginal dryness, which most of the women do not like to discuss, but whenever you see menopausal women, you should discuss about that. And that leads to dyspareunia and discomfort. So that is again important thing. Then mood swings may occur, and these mood swings may affect the overall, the whole family may get affected because of it, because your behavior affects your family. And so mood swings are equally important. And sometimes women tend to get depression, and it many a times remains undiagnosed, and she is already at this time, this is an empty nest syndrome. She's already so isolated, and she feels further isolated. And long-term risks, there are certain risks which are associated with menopause, and that is increased risk of pulmonary and colorectal cancer, coronary artery disease, stroke, cognitive impairment, Parkinson's disease, psychiatric disorders, osteoporosis, and sexual dysfunction. And of these, I think osteoporosis is a very, very important thing because it is one of the biggest causes of morbidity and mortality in the elderly population. So I think that needs to be really addressed, and sexual dysfunction and psychiatric problems and all these make the woman's life very unpleasant. So everything is, I think, important, and we have to really be serious about it. Now, what is the management of surgical menopause? So, as per Indian Menopause Society and international guidelines, there is one use of hormonal replacement therapy for all women who undergo menopause under the age of 45 years provided that they do not have contraindications to menopause hormonal therapy. So it's very important to treat these women. And for how long are you going to treat these women? That is again important. So at least up to 45 years, and many times maybe up to 48, 52 years, depending on their signs and symptoms, but at least up to 45 years. And treatment should continue until the average age of menopause, that is 51 years, and then be reviewed. So it's very important. Sometimes because of endometriosis, people have removed ovaries, and then you forget about HRT. So please be vigilant. Be vigilant about the symptoms. And even if she's asymptomatic, but if she's less than 45, menopausal hormonal therapy should be given to these patients to prevent the long-term effects of menopause. And non-hormonal therapy can also be considered when menopausal hormonal therapy is contraindicated or not desired. Say there is risk of CA breast or something like that. Then in these cases, you can give non-hormonal therapy also. Or maybe patient has got a risk to DVT, to thrombosis. So these are the patients where you can't use hormone replacement therapy. So in these patients, you can give non-hormonal therapy also. Now, this is a very good menopause rating score. And I feel every woman who attends the OPD should have this scoring. And according to this scoring, you'll understand the severity of disease. And then once you have started treating her and her severity decreases, then that way you can assess how much improvement this patient has had on the your menopausal hormonal therapy. Now, coming to one such non-hormonal therapy, and that is Estro-Ease, which contains rheum reponticum extract, and it acts like selective estrogen receptor modulator, and it is new dietary ingredient, and it has been in notification by US FDA in 2008. And this extract is internationally used in Germany, South Africa, USA, and Canada for the management of menopause. As per the latest study published in Journal of Midlife Health, it significantly reduces vasomotor, urogenital functions like vaginal dryness, sexual dysfunction, and psychological symptoms, depression in peri and postmenopausal Indian women. Safety experience with more than 153 million doses worldwide, 21 years post-marketing surveillance data. So this is a thing which can be considered in your patients where patient is not responding to hormonal therapy or where hormonal therapy is contraindicated in the menopausal woman. So with that, I would like to thank you for the patient listening, and thank you very much.